Good morning, everyone. Thank you so much for having me a second time. I'm really happy to be here talking about phase 2 of reopening and the guidance that has come out from that. So I am the Washington County Liaison Officer. So I've done a couple of these presentations already with the chambers. I also man an email and a phone line for businesses who have questions. And I used to put my email on the slide, but we'll be transitioning that help over to the business recovery centers starting next week. So I didn't want to put out my email as much since there'll be a new resource to ask questions and find resources. Next slide. So today I'm going to talk about the phase 2 overview, our county application status and the requirements we need for putting in our application, then cover the guidance highlights, talk about online resources, and then open it up to a Q&A. And we always put a disclaimer in our presentations that this information is subject to change. It's current as of 10:02 on the 16th of June, but this situation is revolving rapidly and things could change. Next slide. Thank you. So for phase 2, a lot of things are opening up, and actually what I've done is I've put a link here to the governor's matrix for what is opening. It's a really great one-page document that shows you what opens in phase 1, phase 2, and then the guidance you need to follow for each of them. So I copied and pasted the aspects of phase 2 that are of importance right now. We've got indoor entertainment, outdoor entertainment, sports, venues, and then additional information for restaurants, wineries, bars, and the like, as well as fitness-related organizations, pools, and children and youth. And so what I really like about this matrix is it goes really in depth into what each of those categories means. I remember at the beginning of reopening when we were in baseline in phase 1, we were saying like, well, what do you consider retail? What is a boutique? Can you give us more examples? What is a personal service? So this goes through and really highlights exactly what she's talking about to reopen in phase 2. Some of the changes that happen in phase 2, as well as that our gathering sizes change. We go from 25, which we're currently in now, to a max of 50 people indoors with social distancing and 100 people outdoors. We also see that in all of our venues, we have a 250 person max occupancy, or based on your floor plan occupancy, whichever is lower. So if you have a very large area and you can fit maybe 300 people, you'll have to go with that 200 person max. I mean, and when you're thinking about it, it's not one single party, but that's how many people can be enjoying your business or your operation in that section in multiple different groups and throughout the facility. And I also wanted to put a note here about phase 3. And this is the only phase that doesn't happen after 21 days of us entering phase 2. So for phase 3, we have to have a vaccine in place before we can enter any of our next phases. So we'll be in phase 2 for a pretty long time. Next slide. So in terms of applying for phase 2, we have 4 new criteria to meet, and those are updated weekly on Wednesdays on the OHA dashboard. And so I've put out a picture of last Wednesday's report to see how we are doing with each of our criteria. So the percent of visits at the ED for COVID-like symptoms should be below 1.5%, so we're there. The trend in percent of tests that are positive in the last 7 days should not trend upwards. We unfortunately are trending upwards in positive tests. The percent increase of new cases in the last 7 days, so this should be no more than 5%. And we're at a 14% increase in new cases. The percent of cases not traced to a known source in the last 25 days, or the last 7 days, sorry, should be below 30%, and we're at 25. So we are meeting that requirement. Trend in COVID-19 hospitalizations should be trending downward, and we are trending downward. And then the percent of cases in the last 7 days to follow up within 24 hours should be 95% or more. We do follow up with 100% of our cases within 24 hours. We're hitting several of these criteria. The 2 issues we see are the trend upward in positive cases and the percent increase in positive cases. So in terms of a reopening date, I'm sure we all heard last Friday that the governor put out a 7-day hold on applications. So what that means for us is we were going to put our application in Monday or Tuesday of this week, but now we are going to wait since the progress dashboard by the state is updated every Wednesday. We're going to look at it tomorrow, see how we're doing on the criteria, because that'll give us a really good idea of if we submit our application, is it going to get approved? And then from there, we'll make our decision on whether we'll put it in or not. So that's why we're not certain about the reopening date yet, but we will make a push out through all of our email chains, through social media, through the regular media when we put our application in. And that way everyone can be prepared for when it will occur. And I also like to just remind everyone that there's no approval process for businesses. So you might be working on your own plan for reopening and the policies that you'll have. You don't need to send that to the county. You don't need to have us sign off. Once we get to the phase that you're allowed to open in, you can just begin operating. Next slide. So in terms of guidance from the governor, I think the best place to go is the governor's webpage. I've linked it here, but it's also pretty easy to remember when you're searching online. It's coronavirus.oregon.gov. So that's where all of the guidance comes out right away. And they put up FAQs as well for each of the sectors. Those come out a little slower than the actual guidance. If you can't find guidance that fits for your specific sector or your type of business, when in doubt, stick to the general physical distancing guidelines. So I've linked here just the general for employers, for businesses, the face covering, social distancing aspects. And on the next slide, we'll be talking about kind of the themes that you'll see throughout each of the guidance documents. And I think that's a really good place to start thinking about how you will operate your business if you don't have a physical document that says your business title in the system. Next slide. So in terms of guidance themes, we see that all of the employees must wear face coverings. And so that's a little more loosely defined than just your face cloth mask. It could be a face shield, it could be a surgical mask. It's any sort of barrier that you need to put on your face when operating. And so I think the face shield works really well if you're in a really hot kitchen and you're working, or if you can't have a mask close to your face because it's going to make it hard to breathe. In any of the situations where employees must wear face coverings, the employer has to provide this. So it's just another piece of the uniform. And so when you're thinking about how many to give people, kind of think of it in terms of the uniform. How many shirts did you give? Did you give them a hat or a name tag? How many of those do they get? Kind of use that same thinking. You can also work with them to see if they already have some at home and maybe supplement what they already have to make sure that if they work every single day, they can use a clean one when they come to work. Another theme is that you need to prohibit any workers with COVID symptoms from working or entering the premises. And so this also works for anybody who is sick and a customer coming in. You want to make sure that if somebody is visibly sick, they shouldn't be out there spreading their germs in the community. Right, as we reopen and we're seeing these cases get higher and higher, we want people to stay home when they're sick. So if you put a policy in place making sure that your employees don't come to work when they're sick, or continue teleworking as much as possible to make sure people aren't getting closer in distance. You need to close water fountains unless they are contactless. You need to post signs or posters about symptoms and social distancing. Extensive hand washing and cleaning procedures are really important right now. So washing your hands for 20 seconds with soap and water or using hand sanitizer. I think we'll see throughout the next couple of slides, some of the things suggest that you put hand washing or hand sanitizer stations throughout your place of business. So maybe on desks, if you're a restaurant, I've seen restaurants put them on every customer table. You might put them if you're a large concert venue, just around the perimeter so people have access to hand sanitizer when they need it. You need to keep 6 feet of distance between parties and between employees. So if a party comes, and the next bullet says a party of less than 10 people, so you've got, say, 2 groups of 8 people, they need to stay 8 feet or 6 feet apart wherever they are in the building. Their parties can be close together. So that group of 8 can stick together and be at a table closer than 6 feet apart, but they do need to be 6 feet apart from the next group of 8 people. Do not combine parties. So if you have a really long table that can seat 20 people and you have a party of 8 come in, they get that whole table. You can't put 2 parties there to use up the rest of your space. Limit congregating in areas throughout the facility. So this includes parking lots, bathrooms, waiting areas, coat check, security, anything like that where people could congregate for more than 15 minutes. Try to come up with a process to make sure that they are not in close physical distance in those areas. And then encourage reservations or advance ticket orders. So make sure you know who's coming, where they're going to sit. Make sure you can hit your occupancy level so people aren't just showing up. Tickets and reservations would help with that. Next slide. So for indoor and outdoor entertainment facilities, so we have the capacity of 250 people, including staff, or occupancy based on social distancing. We touched on this before. That's another math problem you have to do. You know, you can't just take the flat square footage of your building. You might have walls, you might have pillars in place or couches. You know, how can you move around your facility to help social distancing, but also take into account where things aren't movable and how many people can be in your building at a time. Maintain 6 feet between parties. So individuals in the same party do not need to keep 6 feet. Do not combine parties. Remove or restrict seating, consoles, lanes, or anything in your building to maintain distance. And so a good example of this is at the grocery store. They use every other checkout counter. You might want to do that with your seating or lanes or consoles or games, whatever is in your facility. Now, when it comes to cleaning, you need to clean your high-touch surfaces frequently. And it's up to you to determine what frequently is. You know, if you have a rush of people at night between 5 and 8, frequently might be every half an hour. But if you're really slow between 11 and 4 during the day and you're just getting ready and set up, it might be once an hour or once every 2 hours. And frequently might also change depending on the high touch surface you're talking about. You know, more people are going to touch the door handle to come in and out of the facility than they might touch the counter when they're checking in their reservation. You need to clean your bathrooms at least twice a day. And then if you're a facility that uses equipment, games, balls, or devices, it needs to be between use in parties. So if one party is there for an hour and they use all the games and the equipment, and then they leave before the next party comes, all the items need to be cleaned again. Next slide. So you also should keep drop-in childcare, playgrounds, and indoor play structures closed. Should prohibit parties from congregating in parking lots or other common areas like we talked about. End your facility activities by 10 p.m. So this means you need to set your reservations so that the last group of people will be out the door at 10, not making your last reservation begin at 10. And then recommended guidance, so encourage reservations, assign a greeter or a host to manage flow and physical distancing. So somebody who is at that door, who is floating throughout the facility to make sure people are still following the rules and are adhering to your policies. And then consider the use of one-way traffic flow, identifying one door where people come in, one door where they come out, putting arrows on the ground to help people walk around the facility. Some other things you should do are limit the number of staff who serve or interact with each party. So try to limit that to maybe 1 or 2 people, depending on their role. You can use a plastic barrier at the front desk. So as people are being checked in or they're coming for their reservation, have that plastic barrier to protect anybody who is working at the front desk. Provide hand sanitizing stations throughout the facility. Encourage guests to wear a mask or a face shield. And then if you're an outdoor facility, you can encourage visitors to bring their own food or water bottles. Next slide. For bars and restaurants, you need to continue many of your phase 1 aspects. So the guidance that came out for phase 1, which is Keep your tables 6 feet apart, have your parties 10 or fewer, don't multiply parties in one area, prohibit customer self-serve, no preset tables, and then frequently disinfect. Now in phase 2, though, you can continue operating until midnight and instead of 10 o'clock. One thing to note here, though, is that you must reopen at your normal time the following day. You can't close at midnight and then open back up at 1 a.m. to resume operations. You can also add a barrier between any tables or booths that weren't able to keep 6 feet of distance, and that barrier needs to be at least 1 foot higher than head level and then at least 3 foot wide. You can follow the video lottery terminal guidance from phase 1 for your jukebox or coin operated arcade. Encourage reservations again, and then install your plexiglass or barriers. Next slide. For swimming pools, spas, and sport courts, so this guidance applies to general use pools, so at a gym, out in a community, the YMCA, pools like that, and then limited use pools like an apartment complex or a hotel or motel or a private club. And so you need to require staff to wear face coverings when they're not in the water. And you need to limit the use of spa pools to 1 household at a time. For this, you may consider scheduling in 15 or 30-minute increments. So people put a reservation in, they're allowed to spend that much time in the pool or spa, or the pool or spa, and then it's on to the next reservation. And you should regularly check your pool recirculation equipment, frequently clean and disinfect any shared equipment on the sport courts. So this could be a racket, a bat, the doorknobs that people go through, things like that. Limit the individuals in a locker room. So the guidance says that you need to calculate 30 square feet per person in the locker room. And then also assign a physical distancing monitor. So somebody who walks around and ensures that things are going correctly. Next slide. So the guidance highlights for recreational sports. So this is for leagues, coaches, or trainers. Discourage vulnerable individuals from attending sporting activities, right? Since they're more likely to get the disease or have a worse outcome with the disease. Try to keep them still socially distancing and not gathering with a bunch of individuals. Close water fountains unless they are contact-free. Require face coverings when actively not participating in the sport. So anybody who's on the sidelines, anybody who's watching or waiting for their turn to come up should be wearing a face covering. You also should try increasing air circulation by using fans or propping open doors and windows, and encourage people to bring their own pre-filled water bottles. Next slide. Some more guidance is frequently disinfect shared equipment like the bats and the rackets. This should be determined by sport based on frequency. So it could be between players, it could be between periods, or could be between games, depending on what you're playing and how often something is getting touched. Encourage players to bring their own hand sanitizer. So this could be a way, instead of having hand wash stations or hand sanitizer stations around, have everybody have their own hand sanitizer. Clean restrooms before and after league activity. Maintain distance between persons not in the same household. Only allow trainers, coaches, and players to attend practices. So keep it a closed practice, no parents allowed, no spectators allowed. So we have the least amount of people we can in the space. And then develop a plan to limit spectators. So during games or scrimmages, how are you going to have spectators? Where are they going to stand? What rules are they going to have to follow? And designate doors for entry and exit. So again, that one-way flow of traffic would be really helpful for a door in, a door out. If you can do that in a locker room, that would be great. I know not all locker rooms have more than one door access. Next slide. For venues and event operators, this is for both public and private events. I mean, you should increase air circulation as much as possible, provide hand washing and sanitization stations, require reservations or advanced ticketing purchases, maintain contact information for purchasers or attendees of the event. So that'll help with the contact tracing. So similar to how the personal services need to keep down a person's name, when they attended, or when they got their service, who was their provider and what their phone number is. You need to keep the same type of information, and it can be destroyed after 60 days. And we should come up with a policy for if the purchaser is different than the person attending, or when you're going to collect this contact information. Recommend staggering the arrival or departure of guests. So in addition to getting advanced ticketing purchases or reservations, maybe add in a time block where they're allowed to arrive. So that way we don't have people lining up outside of doors and waiting to get in. Or if you're doing the lineup outside the doors, make sure you're marking on the ground where people can stand for that 6 feet of distance, since they could be waiting a while. And then provide a separate entrance for employees and guests. Next slide. Some additional guidance we have is that you should maintain distance between the parties. So inside your venue, if it's a concert hall, make sure you're keeping the 6 feet of distance between groups. Think about writing on the floor, maybe marking with tape where people can stand in their group that is 6 feet away as a visual cue for anybody attending. Prohibit congregating in any area. We've touched on this. Use touchless or cashless payment options and scan tickets without contact. So use credit cards, use the phone paying, make sure you have a scanner where people can use that instead of handing over a ticket or handing over a phone with a barcode scan. Use one-way flows of traffic. Routinely rotate, clean, and disinfect any key or phone bowls and other touch points at security. So thinking about that security area where you walk through, you put things through the scanner, make sure those are getting clean because that's a really high touch point. And then disinfect and clean all sound gear, like microphones, mouses, keyboards, things like that. Next slide. So in terms of returning to work, when we get to phase 2, we'll be going to a limited return of work, which means remote working is only recommended at this point instead of required. I couldn't find too much new guidance out there in terms of phase 2. So I've put together all the stuff we had from phase 1 and some considerations that I've seen people thinking about policy-wise to help you start thinking about your plans and how it would relate to your business if you're going back into the office. So consider modifying employee schedules to reduce close contact on arrival or departure. And so see if staggering those arrivals and departures, if you have a place that everybody signs in, if you have a locker area where people can leave their bags for the day, make sure that not many people are coming at one time. Consider partial telework options where available. So maybe somebody comes into the office now 2 or 3 days a week, but they still work from home the other 2 or 3 days, depending on what their job is and if they can continue doing it at home. And it's up to you to determine what your criteria for deciding whether somebody can work from home or a job can be done telework versus in the office. There's no guidance about that. And again, the county doesn't need to approve that that's your process for having somebody work from home versus work in the office. When you're thinking about telework, also think about vulnerable populations, making sure that if they come into the office, that you're either having people telework at that time to keep them safe and not as surrounded by individuals, or to keep them working from home while people come back into the office. So anything you can do to continue keeping physical distance from our vulnerable populations. You need to provide hand washing or hand sanitizer throughout the office. Disinfect any commonly touched surfaces frequently. So again, determining what the high touch surfaces are and which ones need to be more frequent, which ones need to be once a day, things like that. Limit gathering in shared spaces. So this could be your break room, your conference room, the front desk or lobby, anything like that. And then restrict non-essential meetings or continue using virtual meetings. So the less people we can have in a conference room together in a small space, the better. And also consider regular health checks for employees. I mean, what process you will use if that's something that you're gonna implement. Next slide. So some items to consider when you're thinking about returning to the workplace and writing your plans are cubicle and desk layout. So your cubicles should still be 6 feet apart, or your desk should be 6 feet apart from each other. And the way it works at the county is that when I work in the EOC, we just have tables spread throughout the building. We don't have actual cubicles. So we measure from the center of the desk where somebody's sitting with their computer to the next center of the desk next to them, not the space at the edge of the 2 desks would be 6 feet. So that's how we measure there. If you're using a cubicle, make sure that the barriers go up past the head height, or you can install that plexiglass or that barrier to make them go higher. In terms of a regular cubicle layout, somebody doesn't need to wear their face covering while sitting there, unless some things you should consider is if the cubicle across the aisle from you is less than 6 feet, maybe you have a very skinny aisle, then you'll have to come up with some new ideas on how to keep social distancing there. You can also think about staggering every other cubicle and marking off locations where people can't work to keep that 6 feet of distance. Think about physical barriers, floor markers, so that could be in the lobby, that could be in the break room, throughout the office, things to help people understand how far away 6 feet is or in what flow direction traffic should go. Consider your virtual work policy. Think about cleaning policies for both employees and janitorial staff. So employees are going to have to take a more front responsibility in cleaning throughout the day. At my work, I clean at 1 p.m. and so right after lunch, and then before I leave at 4 o'clock. So those are the 2 times I know I need to wipe down my workstation. You can also put in guidelines about people needing to wipe down after they're finished using a break room or a space that is commonly used. Maybe the conference room person has to wipe it down either before or after they leave. You should have guidance for your conference rooms, your break rooms, and your shared spaces. So in terms of break rooms, you might also think about putting in a policy about bringing or keeping your own dishes from home instead of using any communal ones that might be put in a cabinet. You should also think of some other shared items. So I know we talk about trying to give everybody their own item if possible, which could work if you could give everybody their own phone or their own headset. But what about the printer or a work vehicle if you share one of those? So how are you going to put cleaning procedures in place for that, and whose responsibility is it going to be? How are you communicating that out with your staff? Do you need to keep a visitor's log? So if you have people coming in for appointments, or if you have a wait room, you will need a visitor's log. So things to think about here are how long do you need to keep everybody's information? In the guidance, it says 60 days, but I know from a government standpoint, we have retention rules, so we actually have to keep ours for a year. So thinking about that and how it applies to your business. For security reasons with the visitor's log, can you have an employee take down the information on the computer so somebody comes in and checks in with an actual person versus everybody comes in and signs on with a piece of paper or a clipboard at the front desk? And then if you do the clipboard at the front desk, you have one container that says clean pens and one container that says dirty pens? And do you have an employee whose job it is to go clean those pens and rotate them as they're getting dirtier? Do you have any guidance for field or in-home client visits? So if your employees go out to the field or into people's homes, what do you need to consider there? How should you train them? And what do you need to state about that work? Can you continue doing that? Are you going to limit that as much as possible? What does somebody have to do when going into somebody's house to perform their job. And then also consider face covering requirements. So for my work, you have to wear a face covering when you can't maintain 6 feet of distance from somebody. So that's if I get up to go to somebody's desk for a conversation, if I go get food in the break room, if I go to the bathroom, if I go fill up my water bottle, things like that. But I'm actually sitting at my desk, since I'm 6 feet away from everybody, I don't have to wear the face covering. I have to wear it while I am in a meeting as well. So really clearly stating when people need to wear face coverings and when they don't need to wear face coverings, and making sure that all your employees are aware of that. Next slide. So I've added some resources online that are really helpful. So the first is the effective disinfectants against COVID-19. So this is an EPA website, and they continuously add new products. So the great thing is that COVID-19 doesn't stand up great to disinfectants and cleaning products. So a lot of different products will work. I recommend checking this website when you're looking at products, instead of going to the store and relying on the label. So no product yet is going to have on the label that it's effective against COVID. And that's because manufacturers haven't had the time to come up with a new label or get that out into stores. So this EPA website is a really great reference. I've also added a CDC link for general guidance for businesses, employers to help them plan, prepare, and respond to COVID-19. So taking all the considerations we've talked about today, looking through that website, starting to think about what you need to do to get back into the office. The Department of Labor guidance for employer paid leave requirements, and that's a great place to look. So if you're thinking about people who have to stay home sick, if they quarantine because they might have been exposed to somebody, what are your requirements as an employer to provide and for how long? And I also have linked COVID-related posters. So since you need to post posters about the symptoms of COVID-19 and then how to maintain social distancing, and we have a bunch up on our county website. I've also added a sign from OHA that says maximum occupancy. So it leaves a big white box and you're able to write in what your current occupancy is so customers know as they're coming. Next slide. Okay, so that's the end of my presentation. I'm going to turn it over now to any questions people might have.
Wow, that was a lot of information, Alita. Thank you very much. So we have a couple of questions in the chat. I'll just start there. And then what I would ask is folks to unmute themselves, ask your question, and then please mute yourself again. So question 1, shared equipment are allowed in phase 2, correct? Dance teachers do not have to wear masks in phase 2 since they are participating in a physical activity that makes masks very difficult. Is that correct? Since sport teams don't have to wear masks, I'm hoping that that applies to dance teachers. Do you have an estimated date for phase 2? And that's it.
Great. So to start out, shared equipment, it does say in the guidance that you can use it as long as you have a plan and you're frequently disinfecting it. You can also look at the guidance for summer camps with kids, and they talk a little bit about shared equipment there too. If you have a cohort of 10 kids all using that equipment, it doesn't have to be disinfected between each child. They all share it together, and then you disinfect it when the next group of 10 wants to use it. In terms of dance teachers not wearing masks, so there's nothing explicitly stated in the guidance about that, but I think your thought process is spot on there. And so that's, I think, a decision you'll have to just commit to, whether or not you think that you have a good enough reasoning for why you don't have to wear it. I think that that is a pretty good reason, but from a county standpoint, I can't tell you, go ahead and do that, you know. And then, do you have an estimated date for phase 2? Yes and no. We've been continuing to throw out the June 22nd date, but it really depends on what the data looks like tomorrow when that comes out and when we think we'll be able to get that application in. So not really, I'm sorry.
All right, so there was a question about conference rooms. Can you touch on conference rooms one more time?
Sure. So with conference rooms, You just have to keep the 6 feet of distance between individuals, or everybody has to wear face coverings. So with meetings that I've participated in, we try to keep at least 3 feet of distance with our face covering, or 6 feet of distance without it.
Okay, what is the difference between the two guidelines that the county is not currently meeting for phase 2?
Let me pull it up so I can read for word, and then I can get that answer to you. So the trend in percent of tests that are positive in the last 7 days versus the percent increase in new cases in the last 7 days. So the trend in percent of cases of positive cases is we have more and more testing occurring, which means we're going to have a wider base of tests to pull from. So in that event, what we should be seeing is that the number of positive cases stays pretty low, and that the trend that we aren't seeing an increase. As we increase the amount of tests we do, we shouldn't also see an increase of positive tests. When we talk about the percent in new cases for the positive days, that's just the base numbers. How many positive cases are we getting every single day? And that can change depending. So some days we have 10 new cases, but we've only done 100 tests. And then the next day we might have 4 new cases, but we've done 200 tests. So that's where that percentage comes in.
Excellent.
And please let me know if that was enough to clarify your question.
Brad, are you clear now?
They still seem like the same thing to me.
Yeah, they're definitely linked, but there's a little nuance from the epidemiology side, from the data tracking. But I think as you see a percent increase in cases, we'll also see that trend upward, right? So it wouldn't be the fact that we see a downward increase, but we still have over 5% of new cases every day. That makes sense.
But isn't that, I mean, it's going to be kind of tough to ever meet that one, I would assume, until the COVID is not in society. I mean, the percentage,
Yeah.
I mean, it would seem like the more you test, the more you're going to find, symptomatic or non-symptomatic.
Mm-hmm. Yeah, and that's a discussion that public health has with OHA also, when these new numbers come out and when we're going to be putting in our application. We talk to them and we think about what happened in the past couple of weeks, and if we think it's a one-off incident, or if we think that this is indicative of how it will be if we continue opening. So it's definitely more of a conversation, as well as looking at the data to inform that conversation.
Okay, we have another question about what is the mask guidance for general office? Are employers required to provide masks for employees, and are employees required to wear masks?
So if your employee needs to wear a mask at work, the employer needs to provide. In terms of the guidance, there's no document I can hand you from OHA. It's just kind of what everyone has been doing and piecemealing their guidance to fit their situation. And so in terms of when people need to wear masks, I think that comes down to you thinking about what your office is like, what areas you can keep the 6 feet of distance and where you can't, right? And so the guidance from OHA is that you need to wear a mask when you can't keep 6 feet of distance. So using that, I think, and then moving forward, creating your policy will help you identify those areas.
Excellent. All right. I don't see any other questions in the chat, but I have a question about whose names who is required to take names of their customers. So restaurants know.
Correct.
Correct. Because I think early on they were talking about the fact that you would have to, and then they changed that. And so here's, I'll use an example for the chamber. So we have free hand sanitizing that we're giving away through the City of Hillsboro's grant program. And it's in our office, and we walk in the entrance and people fill up their bottles. It would take more time for us to take down their names than they are in our office. They're not really interacting with anybody but the hand sanitizer, which seems like it's a safe place for them to be, by the hand sanitizer. But would that be a situation where we should have a log where they would write their names down? I mean, literally they're here less than 5 minutes.
Yeah, so I would say when you think about doing the log, it's when you have customers or clients coming in for scheduled appointments or there for service with somebody else.
So prolonged period of time that they're going to be with you.
Mm-hmm.
Okay, so we do have a couple other questions in the chat now. Would you be able to touch on record keeping one more time? How long should we store visitor logs and employee logs?
So for record keeping, you need to keep somebody's name, their contact information, what time they were in the building, and who they went to see. And the guidance says you need to keep it for 60 days before destroying it. The example I had given, though, is since I work in the government, we have some different rules. And so we have retention rules we need to follow, which means we keep all the information for 1 year instead of 60 days. So if there's something similar like that, I don't know, maybe if a nonprofit has rules like that, or if your business has retention rules longer than the 60 days, follow that licensing guidance.
Got it. For wedding venues, is the business owner responsible for keeping track of the event attendees?
Yes, if you are the owner of the building or the space and you're renting it out to somebody, it's your responsibility to have that log. Now, that doesn't mean that you are the one who has to physically go and fill out all that information. You can work with the person who is having the wedding to provide that information to you, but you're the keeper of that, and you're the one who public health will turn to when they have questions about an incident.
And so if you have attendee, if you're a wedding venue and are you responsible for the attendees then following all the guidance? So is it the wedding venue that's articulating to the bride and groom or whoever's renting the venue what is required for their attendees, and then responsible for enforcing that during that event?
Yeah, and so you can have just one of your employees, maybe in the catering department, or if you have like an assistant who does some of the office work, just float around during that event and remind people like, hey, can you step back a little bit in line, or asking people like, oh, wash your hands first before you come up to the line. Just making sure that we have those gentle reminders. But I don't think anybody is going to be coming around from the county, peering in your window, watching and counting how many are in there. So it's not that stressful of a situation, and don't really get worked up about it as long as you have somebody there who is helping people understand and follow the rules to the best of everyone's ability.
Excellent. So if your customer is waiting outside for their child, so they pick up a child at the dance studio and they never enter the building, you don't have to keep track of that name because then they're never coming in.
Right, but the child you should have the information about.
Right. What specific information, I think you covered this, do we need to collect from attendees? So it's the name, contact information, time, and who they visited or what they did.
Mm-hmm.
Did I get that right?
Yes.
I'm learning. Does the same hold true for hotels? Is there a small meeting taking place in our if there's a small meeting taking place in our meeting space, are we required to have the log? And I would imagine yes.
I would say yes to that, yeah. Yeah, and a lot of these times when you have a meeting or people coming in, they're already used to signing in. If they've reserved before, they come in, they find their name, and they sign that they were there. So it's not that much harder, I think, to add a couple more columns to have them fill out. I mean, you can also consider putting up a sign with the log that says, like, this is the information we need from you, and this is why. Because somebody sees that log and they're like, well, you've never asked me for my phone number before. And then there's a sign that says, this is in case somebody in here is sick and we want to contact you. It's for your safety.
Has the EOC put together any sort of that type of signage that is like maybe, you know, for the use of contact tracers, we're asking for this information, just or simple things, that terminology that we could pick up and cut and paste, or we could print out?
I think OHA has created some. After this, I can go onto their website and pull a couple of links, and I'll send it to you, Deanna, and you can forward it out.
Excellent. Thank you so much. It's
Yeah,
always,
and I think
it's just difficult to figure out how to effectively articulate some of these rules and regulations, and not to make it seem scary, but make it seem appropriate for the situation.
right. And I think when it comes to signs, I mean, we're all dealing with the same issues right now. We all have the same questions. So there's going to be somebody out there who has already made the sign and made it available for the public. We don't have to start from scratch or reinvent the wheel. So there's definitely resources out there.
Absolutely. Wow. All of your questions have been answered by this phenomenal resource. I mean, so anything else, Alita, that you think that we should be thinking about, that sort of overall guidance? I guess the other thing is, in terms of, has there been any conversation regarding, you know, sort of customer education or consumer education, that this is all about, you know, really how to, how for businesses to behave, and things that they should do and how they're regulated. But I think the other side of that is really from a consumer standpoint and customer standpoint. How do we get customers to understand that businesses are just trying to follow the rules that have been regulated to them?
Yeah. And I think when it comes to talking to customers and having them follow your new guidance, majority of them are going to be understanding. You know, they're living through this as well. They're experiencing it too. They might have their own feels and actually be appreciative that you're doing this. But when it comes to talking with your customers or letting them know what new things are happening, you might think if you have a virtual newsletter you can use, turning to your social media pages, you might put signs on the front door, things like that, just as visual cues to start letting people know. And then, of course, coming up with a gentle way to talk to them if they're not adhering to one of their rules, your rules, right? So have some talks with your employees and say, like, if somebody's not doing it the way that we would like it to be done, you know, these are the things you should start saying. This is how you should tackle it and think about it, and not so much as they're willingly disagreeing with what you're saying and what you would like. I mean, I think one of the things I would like to leave everybody with is, when you're making these plans and when you're trying to reopen and going through all the guidance. So I think two things to remember is that we at the county and all of your licensing agencies and anyone who is actually doing enforcement knows you're trying as hard as you possibly can. We know that you're doing a good job. I mean, we're here to help you, not trap you or get you in trouble or fine you. And the second thing to think about is, if you're looking through guidance and you have a question, you can't really figure out how it would apply to your situation, or you're trying to look for specifics, think of the spirit of the guidance more than the letter of the law, right? So the spirit is, we're trying to keep people safe. We want to keep people social distance because we know the closer you are, the easier it is for the germs to spread. We want people to wash their hands often so that they don't have that germ that they can be passing around. And we want to make sure that things people are touching are also safe. So as long as you're keeping in with that spirit and the goal of keeping somebody safe, you're on the right path.
Excellent. I think there was a question about keeping a log for a private dinner that's catered.
Yeah, so it's an event, so I would still keep that log, and I would put it on either the catering company, the location, who is hosting the event, or the coordinator of the event to be the end person to hold that log. And I think in that event too, it would be important to talk between the caterer, the event space, and the person having the party, so everyone's on the same page about who is holding that information. Right? If the county calls one group and they say, oh, well, we don't have it, but we've already talked and we know the caterer has the information, so here's their contact information. And that way everybody is aware of who has the information and how to help if the time comes.
So there's a question about whether there was a sample of a log available online.
I'll have to look for that too, and I'll send you anything I find.
So we have a minute or two left. I thought maybe let's talk about the worst case scenario that someone came to your venue and they then got sick. And what is the process? How will, so will the business be contacted by the county? Is that what happens? So if a positive COVID-19 case happens, then immediately you're starting to do the contact tracing to find out where they've been, correct? So just walk us through what that's going to look like.
Sure. So what happens is somebody gets sick, they take a test and it comes out positive. That positive is sent to the county, and the county then has 24 hours that they are required to follow up with. So in that 24 hours, somebody from the county will reach out to the person who tested positive and walk them through an interview where they have been in the past 14 or 10 days, or when they've been symptomatic or contagious, and find all of those locations. This person also gets asked questions about if they have to stay home for the next 14 days while they're sick. Are they able to provide for themselves? Do they need support in any way? And what type of support do they need? So we have people who will also help them figure that aspect out of staying at home while they're sick. The county then takes the information from that contact tracing interview and starts calling each of the people or the places identified. So as a business, or if it's your employee, you'll get a call and it says, somebody who is your employee was here from this day to this day and this time to this time, they have tested positive. And so they're going to try their hardest not to tell you the actual name, since that's protected health information, but they will give you all the information you need to know about when they were there and where they were. So you can then provide, oh, these 4 employees were in the conference room with that individual or in that same conference room during that time. Here's their contact information. And then the county uses that contact information to reach out to each of those employees. So it's not on the business to conduct that contact tracing or let people know. You can, as a courtesy, let somebody know, because in a lot of cases, what happens is somebody will test positive and they'll find out sooner than public health sees the test. Maybe by a couple hours, because we get multiple tests in that we have to look through, and this person just got an email or they looked on their app. So your employee might call you and say, hey, I just tested positive. And then you're going to, okay, what do we do mode? You don't need to call the county to report it, right? Because we have those tests, we'll get to it in an hour or two, just a little bit behind you. And then you don't need to conduct your own contact tracing. So you don't have to say, oh, you just tested positive. I know you worked with Sarah during this time, so I've got to tell her and she has to go get a test. That's all going to be done at the public health level. What you can do if you want is, if you hear an employee has tested positive, you can put out information to your employees saying, hey, we just heard that somebody tested positive. You might hear from public health if you were a close contact. Please remember to wash your hands, social distance, don't touch your face. You know, if you're concerned that you might be a contact, monitor your symptoms for the next couple of days, take your temperature, see if you have a cough. If able, work from home. And just as like a courtesy reminder, but it's not required and you don't have to, but a lot of people do just like knowing what to do now, and because they're scared and they want to help.
Excellent information. Thank you. So we have a few minutes left. Any final questions for Alita? My goodness. You covered everything in so much detail. It's really, really helpful.
I wowed them into silence.
You have wowed them into silence, or scared the heck out of them. I don't know what it is, Alita. But this is, I mean, obviously for everyone, it's a lot, and it's trying to figure out, how to navigate both with your employees and your employees that are customer facing, and, thinking about onboarding your employees maybe back into the office, but also if they're customer facing employees, thinking about how to onboard them with those interactions with customers. And if you have customers that aren't necessarily aware of or following the regulations that your company has adopted, make sure that you help keep your employees safe from that kind of potential abuse from outside people that don't want to follow the rules, and help them understand how to navigate those questions and how to elevate that as well. So if there's issues with a customer, make sure that you have a policy in place of how that employee can elevate that to a supervisor or a decision maker, that they're not taking that on themselves, because there's a lot to coming back to work from a rather isolated environment, and all of a sudden you're back in the world, interacting with folks with social distancing, but also just a lot more people in your ethos than you've had for the past 2.5 or 3 months, and it's a lot. All right, folks, hearing no last words, no last comments. I want to thank you again, Alita, and I know that you're going to be around for a while in the midst of all of this. I know that you've talked about transferring the business liaison piece of it to the BRCs. The Hillsboro Chamber is one of the BRCs, so we are looking forward to that conversation with business, and I want to thank you for all that you've done for our business community and helping them navigate this and answering their questions and helping assuage their fears around all of this. You've certainly been a leader in that role, and I just want to thank you for that.
Thank you. It's been my pleasure.
Excellent. Well, thank you again. Stay safe, stay healthy, have a great rest of your week, and take care.